link so that we can send it to everybody once it
Okay.
starts.
Okay, sir.
Asmita ma'am, I also have the edited slides that were sent by the panelists, so I'll share it from my computer for the panelist profile, ma'am.
Okay, sir. No issue.
Let's check with the Palande. You send the mail to Palande also?
Yes, sir.
Trupti has joined. Okay.
It's been sent to dapalandE@hotmail.com, sir.
Let me check.
Yes.
Okay.
Good morning, Dr. Surya.
Morning.
Good morning, Guan.
Good morning, Vidya ma'am.
Glad to be here and thank you for calling me on this session.
Happy to meet you, ma'am.
Sir, can I open the room for attendees?
I think so. You created a link, you sent the link.
Hi, everyone. Good morning.
Hello.
Go and just remind Abhishek if he's like to join.
Sure, sir. Yes, sir.
Hello. Good morning, sir. Is my voice audible, sir?
Yes, yes.
So is there a lot of disturbance? Yeah, at the camp, but I've just come to a quieter area. Just want
There
to
is
make sure
some.
there is no disturbance. So I'll
There
move
is
to
some.
a little bit. All right, sir. Thank you. So I just wanted to confirm if I'm audible. Hello?
Yes. Yes, audible.
Okay, thank you.
Ms. Asmita, I think Dr. Deepak Palande sir is in the attendees.
Okay, ma'am, I'll add.
Dr. Palande has joined, so we can start the program if everybody is around, since Abhishek is held up somewhere.
Can you hear
Go.
me?
Yeah, we can hear you. So, Gohan, could you introduce the chairperson
Yes, sir.
and moderator?
Yes, sir. So, good morning, one and all present here. It gives me immense pleasure on behalf of the Indian Federation of Neurorehabilitation to welcome one and all, the chairs, the moderators, the panelists, and the attendees on this day of World Disability Day, where it's our duty to create awareness and provide the people with disability with the utmost care, not only in the hospital, but also forward into the community. And World Disability Day, and it is officially known as the International Day of Persons with Disabilities. And it is celebrated today, annually on the December 3rd. And the day aims to promote awareness and understanding of disability issues while mobilizing support for dignity, rights, and well-being of persons with disabilities. Here are some key reasons that why we celebrate this day. One is to raise awareness. Two, it's to advocate for inclusions of these people in the community, highlight their achievements, promote the accessibility, advocate for their rights, foster the empowerment, encourage policy development, combat stigma and discrimination, global solidarity, and to evaluate the progress that we are performing in the rehabilitation of people with disability. By celebrating World Disability Day, the international community reaffirms its commitment to create a more inclusive and equitable world where persons with disabilities can live with dignity, participate fully in society, and enjoy equal opportunities. With this short introduction, I would invite the panelists, and we will proceed with the introduction of the chair and the moderator. So are the slides visible?
Yes, sir.
Okay. So to introduce the chair, Dr. Abhishek Srivastava, sir. He is a neurorehabilitation specialist and director at Center of Rehabilitation, Kokilaben Dhirubhai Ambani Hospital. He is the chair of the neurorehab subsection of IAN, and he is the secretary of the Indian Federation of Neurorehabilitation. And his areas of interest includes botulinum toxin for spasticity, rehab robotics, hyperbaric oxygen therapy for disorders of consciousness. And his achievements are, he is a WHO fellow for TBI rehab guidelines. He is the chair of the SIG multiple sclerosis WFNR, secretary of IFNR, and he's the organizing secretary of WCNR and Asia Oceanian Congress Neuro Rehab 2021. He is an IAPMR gold medalist, and he has over 60 publications. Dr. Deepak Palandesa, who is the first head of the department and neurosurgery at Sir J.J. Hospital, Mumbai, and he is a honorary founder director, IFNR. He is the chair member board of studies, and he has held various positions, including the president of Maharashtra State Medical Teachers Association, Maharashtra Association Resident Doctors, and is the secretary and president of Bombay Neuroscience Association, and is the chairman of the proposal committee of PMSSY project of Sir J.J. Hospital, Mumbai. He has also received various awards, which includes the Best Teacher Award, the Bhim Ratna Award, Vishwa Kalyan Arogya Award, Seva Award, Achievement Award by the Birla Matoshri, and Best Teacher Professor category GMC and Sir J.J. Hospital 2012. We welcome Dr. Abhishek sir and Dr. Deepak Palande sir. And now coming to the introduction of the moderator, he is my mentor, and he is a person who requires no introduction, but on formal grounds, he is chairman of Surya Neuro Center, Mumbai. He is an associate professor at the Bombay Hospital Institute of Medical Sciences, Mumbai. And his area of interest includes neurorehabilitation, epilepsy, and stroke. And he has revolutionized neurorehabilitation and inspired many young people into the field. And he was the former president of the Indian Academy of the Neurology. He's founder president of the Indian Federation of Neurorehabilitation. He's currently the president-elect of AOCNR and taking over as the president this December. Founder, trustee, and chairman, Epilepsy Foundation of India. He's treasurer, Natai Neuroscience Academy of Telecare and Artificial Intelligence. He's a member at large at the WFNR. And he is the past president in Maharashtra Association of Neurorehabilitation, Bombay Neurology Association. He's the recipient of the prestigious Kenneth Viste Jr. MD Patient Advocate of the Year Award and Mahatma Award winner. We welcome you, sir.
Thank you. Thank you, Guhan. So it's indeed a pleasure for me to welcome you all here. And to begin with, Guhan has already introduced, but let me again emphasize that International Disability Day, which is today, 3rd of December, has been celebrated since 1992, ever since United Nations thought of having this as a very important day. Now, as you all are aware, and if you don't know, there is a 1.3 billion people are suffering from disability across the globe. And that means it affects the 16% population of the globe. And out of which 80% of the disabled people live in developing country, and India is one of them. And the disability rate in India is about 1.2 billion, as it was recorded to be 2.2%, 2.2%. And this year, the theme of the Disability Day is United in Action to rescue and achieve the Sustainable Development Goal for, with, and by person with disability. As you know that WHO has come out with the Sustainable Development Goal, and they find that there is a significant gap in this, and therefore it is very, very important that we look at the equity, health equity, we look at the removing the discrimination, have a proper policies and quality of care for the people with disability. I must also emphasize that the 1 in 5 women at some point of time in their life suffer from disability, and same is about 1 in 10 children in some time of his lifetime is been suffering from disability. So it is a serious problem. There are a lot of problems, and to understand all those problems, the Indian Federation of Neurorehabilitation has got the team who looks after the people with neurodisability in all and other disability. And as you all know, that elderly are the one who has about 46% may have some form of disability, and therefore we have discussion coming on the elderly and disability. So we have in our multidisciplinary team, we have neurologists, Dr. Guhan Ramurthy, if I can have his introductory slide. before I start the question, please. So, the, so Guhan is a neurologist, neuro rehab specialist. He's already mentioned he's my mentee, but he has just been trained at fellowship from Singapore, and he has gold medal award in DNB neurology. He has gold medal, the Sumathi Naranjan University gold medal, A.V. Srinivas gold medal, award of excellence in best patient care, and gold medal in rheumatology and physiology. He's been doing excellent work, and you'll hear more and more about him in the future. We have a pediatric orthopedic surgeon, Taral Nagda, who has been involved in a lot of cerebral palsy, polio correction, and he is currently the pediatric orthopedic surgeon at SRCC Jupiter Hinduja and Shefi Hospital. He's director at Jupiter CP Clinic. He has also run the gate analysis lab, and he has been part of all our IFNR Congress very actively, and very, very innovative ideas he comes with. So welcome, Taral Nagda. The next is a physiotherapist, Professor Suvarna Ganvir. She is head of Department of Neurophysiotherapy at DVYPF College, Ahmednagar, and she has many credentials. She is presently the Maharashtra Women Cells Secretary. She is also FAIMER Fellowship 2011, and she has been very active in neuro rehabilitation. Important thing is she's associate editor of Journal of IAP, and we had come out with supplement last year for the AOCNR. So welcome, Dr. Suvarna. Next is a occupation therapist, Trupti Nikharge. She has worked with me ever since 2000 when we started the neuro rehab first OPD in India at Nayar Hospital, and she has been very, very actively involved in the pediatric rehabilitation at Nayar Hospital. She has interest of sensory and motor issue in children with development disability, and she has a lot of credential, and she's been very good. Welcome, Trupti. Next is neuropsychologist. AP Port Elvis is a young neuropsychologist who has a lot of credential, come just back from the United Kingdom after getting trained for the further study, and she got a lot of credential there. She got recipient of International Neuropsychology Society Early Career Award and British Psychological Society Early Career Bursary in 22 and 23. And she did author of TAM Battery, a multilingual computer-assisted neuropsychological assessment battery. She's co-chair of membership committee, Asian Neuropsychological Association, also on the culture SIG of International Neuropsychology Society. So you will hear more and more of her in coming years, and we are going to hear from her. The next panelist is Lukesh Buyar, and he is an orthotic. He is attached with healthcare rehab professional with, he is attached with AI PMR, and he's a clinical prosthetist and orthotist, and he's also got a lot of achievement. He has been very active, and I welcome you, Professor Dr. Lukesh Buyar. Then we have speech and language therapist, Preeti Sethi. She's assistant professor, Department of Audiology and Speech Language Pathology, Kasturba Medical College, Mangalore. And she's been very active in rehabilitation. She's also the one of the mentee of Professor Michael Todd, the music therapist, and she recently conducted a national conference in Mangalore on brain and aging. So she's been very active as a speech and language pathologist. Welcome, Preeti. And last but not the least and most important person is Dr. Vidya Shinoy, and she is master in economics, qualified in management of yoga, and the most important thing is working for the Alzheimer's and Related Disorders Society as an honorary secretary for Mumbai chapter, Secretary General for ARDSI, and she has been very actively involved and proactive for the people with dementia and neuropsychologists, dementia and social cause. So I welcome you all. And to begin with, you are most senior. And I think I just want to ask one simple question to all the panelists. And I will request them to kindly keep the answer very short. This is the first question. So Vidya, what Disability Day means to you?
Actually, Disability Day is a reminder to people who have forgotten that this should be all the year around. Disability doesn't mean they cannot, but we are not giving them a chance to do. To be able to recognize the positivities in any disability and cash in on their positives and work on their inability. That's what disability means to me.
Thank you. Dr. Palande, you need to keep your mic mute, please. So, Taral, what disability means to you? Disability Day means to you. So this question goes to everybody. That just quickly, I want to hear from
Yeah,
your
absolutely.
specialty point that what does it mean to you?
So first of all, it means celebration. So Nirmal Surya sir and everybody on the dais and everybody who's watching it, no, it's Eid Mubarak. IDD is International Day of Disability. So it's Eid Mubarak to all of us. Here, it's not about suffering. It is about courage. It is about hope. It is about celebration and looking at abilities of people who are disabled. So that is what it
Thank
means to me. Thank you, sir.
So Eid is the word which comes. So that's perfect. Guhan, what does mean to you as a neurologist?
The disability aspect as a neuro rehabilitation specialist, when I evolved from neurologist, was that the same amount of deficit can produce different amount of disability for various patients. So it is this functional deficit that contributes to the disability that we will have to minimize. And as a rehabilitation team member, being a neurologist, it becomes an important and imperative part of me to improve the functional capacity of these patients and reduce the disability. And this can be done by increasing the awareness in the community. And they take this opportunity on this day to perform this. Thank you, sir.
Thank you. Thank you, Guhan. Suvarna?
Good morning, all. And I believe Disability Day for us as a physiotherapist means reminding ourselves to move from dysfunction to function for all patients who have either got a locomotor disability or other types of disability, and reminding ourselves of the commitment that we have and laying out the foundation for the new things that we should try for moving the patients from dysfunction to function. Thank you so much.
Thank you. Porselvi, as a neuropsychologist.
I think it's a day that we ask ourselves, are we doing enough? Like as stakeholders in the world scenario, I think it's a day to ask, are we doing enough? What needs to be done further? And kind of taking stock of what's been done so far.
Thank you. Preeti?
Yes, thank you, sir. It means promoting the right for the well-being of any patients we have in terms of any disorder or any domains that we have. We have to look at different possibilities in terms of political, social, economic, and cultural life of individuals with disability. So it's about promoting and creating awareness for the right of the person with disability.
And lastly, going to the Trupti.
For me, I think Disability Day is like celebrating the achievements of our clients and making us realize what more we can do for them to integrate them into society.
So we got a neurosurgeon who is also should be in the esteemed panelist. So Dr. Palande, what does signify the Disability Day and neurodisability as a neurosurgeon? What is your perspective, Dr. Palande? You need to unmute yourself, Dr. Palande.
Can you hear?
Yeah.
More than almost 16% of population, global population is disabled significantly, causing some or the other problem. So it's a very important issue, and the basic aim of the WHO is to get all these people into the functioning of the society, and that's why to make people aware of this this day is being celebrated. And I feel at least in India, we should pay more attention to looking after these issues of the disabled people. Because when we go out in say USA and all, we see disabled people roaming around the whole city. They can travel by bus, they can travel by train in a wheelchair. And here we even can't go on a footpath because all the footpaths are occupied by other people and they are not well maintained. So these are the issues in India which have to be tackled on a war footing actually to help
Thank
these
you.
people. Yeah.
Thank you, Dr. Palande. I have a very important guest here. Professor Mandasir is professor in neurorehabilitation from Mongolia, and I welcome her to be here today, part of here. Thank you. Welcome, Dr. Mandasir. So the most important thing is that you all have mentioned about the different angle from your point of view about the disability. And I think that we need to now look into the sustainable developmental goal of disability. And that's where, as Dr. Palande pointed out, the policies, the discrimination, the health inequalities, quality care, and health care united in action will be worked on. And so by 2030, when we are talking about WHO's 2030 Rehab 2030, we are looking at all these problems. So Taral, now what are the special challenges and barrier for children with disability? And I would request all of you, because the panelists are 10 in number, to keep a question short so that we can have 3 or 4 questions rather than 1 or 2 questions. Taral.
Absolutely. So, thanks, Dr. Surya. The child and adult, the difference is child is growing. Child's body is growing, the bones are growing, but at the same time, the child's mind is also growing. So one thing which we don't realize, when a child has a disability, the child faces discrimination from day one. When a child is born with a disability or gets a disability, people around, the relatives, everyone, looks at that child as a specimen, something different. They don't look at the child as one of us, one of in the family. That continues into the school. The child is discriminated if child happens to go to school. When there is a peer group, there is a discrimination. Dr. Nirmal Surya, we have a child with CP who's become an adolescent now, and he wanted to go to a nightclub. This is just last week, and he was not allowed to go to the nightclub because he has cerebral palsy. This is the kind of discrimination we face. If that child becomes a young adult, starts earning, and wants to develop a bank account, if you cannot sign because of a neuromotor locomotor disability, you cannot have an independent bank account. So there is a discrimination which child faces more than an adult, and a mind of the child, suffers a lot. So this is, one of the ways I've learned. It, it uh, the discrimination leads to the differences, and we want to prevent this. Thank you, sir.
I think I agree with you. And on that note, with children, I want to ask Shrupti how you can, make a difference in the disability in the children. As Taral has pointed out, you work closely with the pediatric population. So how do you think that we can change this perception and the children need? You will be more aware about how you face the disability in children.
Yes, sir. Thank you, sir. As rightly said by Dr. Taral, sir, these are the discriminations faced by our children. And yes, as an occupational therapist, I feel most important thing is first getting the child near normal by adapting his environment. I think we have to create awareness in the society too. But first, getting the child more accessibility by changing his physical environment, his adaptations to him for maximizing his functional independence, like giving adaptive devices wherein he can be more functional, and improving his functionality can prove his efficiency. And I think that may, I don't know how much our society again has a lot of discrimination. So I feel making the child functionally independent in his areas can help him to overcome this to some extent. But changing the thought process of our society is a big challenge, and it has to be taken over by many people, communities together. Our cultural system is so diverse that many values are looking into disability in a very different way. So getting that into account while training the child and modifying the environment is very important. Thank you.
Absolutely. So, Suvarna, you have been a professor, you have been teacher, you have trained so many uh, physiotherapists. From physiotherapist perspective, what do you think that how does the curriculum include the disability care? How much your therapists are motivated and ready to make a difference in the disability as such?
Okay. The physiotherapy curriculum is entirely based on enhancing the competencies of the persons with disability. Every subject that we have is oriented towards making the patient's quality of life better. So I think as such, the curriculum is very well oriented towards the disability competencies, improving the competencies in disability. But I feel what is required or what change is required as far as physiotherapy curriculum is concerned is the inclusion of the changing needs of the society as far as improving the quality of life of the persons with disability is concerned. So the change of the needs that has come in recent 10-15 years, that change probably is not included in the curriculum. So I think that is somewhere we can improvise our curriculum. And the second thing that I wish is the newer methods of teaching and learning with respect to how can we integrate these persons with disability into the community. That is, I feel, can be improvised upon as far as the curriculum is concerned. Thank you.
Would it be possible for you to take as sustainable development goal into the action in your practice, in your teaching now onward?
Yes, sir, absolutely. We at our center, at our institute, we are into the collaboration with a lot of NGOs which take care of these persons with disability. So we are doing at our institute, but as I said, a change has to come at the curriculum level. So maybe at the university level or maybe at the national level, the changes needs to be done. And I, being a part of 3 BOS studies groups, I feel I have initiated that particular change, but the effect would take a little longer time to be seen.
Thank you. So, Lukesh, you are a very important person when it comes to the disability because you only deal with the disabled people, and I think it is the most unknown branch in India. There are very few orthotic there. I do not think that people in a smaller town or smaller places would even know that there is some orthotists are there or not there. And tell us about how important it is as an orthotic for the disability, and what are the gap today in providing the assistive technology to the people who require the disability, and how you think that it can make a great difference a day like this where we can speak out to the government, to the society, to about their right.
Yes. So this inclusion of differently able people in the society is very important. They have a lot of potential. They can do, they can perform a lot of things. They can excel in their life where the normal person cannot do. They can excel better than that also. It is a finding. Yesterday only, there was a wheelchair cricket match, and the recreational activity was performed in such a way that the players enjoyed a lot, and they could perform that because of the accessible environment and then provided with the mobility aid. So, so I feel that if the differently able people provided with these assistive devices, processes, orthoses, they excel in their life. The gap in current scenario is very much, yes, because there is a lot of awareness, less awareness in the society amongst in rehabilitation professionals itself and then in the society itself. So we need to have awareness programs like this. We are organized. I'm thankful to IFNR for organizing this and inviting me. So these are the things which can be, and the government is although looking into the different disability sectors, developing the disability sectors, developing a disability mantralaya itself in Maharashtra started in the first time in India. So this is the initiative, and this will go along way. And the education sector also helps to improve the disability scenario in India. Thank you.
Hello.
Yes, sir.
We can hear you, sir. So you're muted.
Can you hear me?
Yes,
Yes,
sir.
sir, we can hear you, sir.
Some issue with my.
So meanwhile, I'll continue with till Sir joins. At AIPMR, we used to see the disabled people with a total rehabilitation team starting from the PMR department, then physiotherapist, occupational therapist, medical social worker, then psychologist, vocational guidance department. All the team evaluate, help the differently able people to achieve their goals. We work on their goal system, and then help them to get into the life. Thank you, sir.
Thank you very much, Dr. Buer. Let's talk from, as you talked about the government and thing, let's hear from Guhan. Now, Government of India 2016, the Disability Act, government has tried to cover many neurological disabilities. You are aware about that. Tell us how it has helped and how it is changing. I know there are not many enough contribute as an IFNR for this initiation.
Sir?
Yeah.
So the government, how it has helped in people with disabilities, sir?
So in National Disability Act 2016, which was passed by the Parliament in November, are you aware about it?
Yes, sir, but not the intricacies of it, sir.
Okay. So we will ask Dr. Palande. Dr. Palande, you know that 2016, the act, the Disability Act, which was revised, and the few of the disability was covered, which is now expanded. So, you know, diseases like multiple sclerosis, Parkinson disease, etc., are given much more weightages beside hearing loss, visual disturbance, and there is a category other neurological disorders. So, you know, you have almost all the neurological disorder come under that category, and there are benefits which can be taken by this. So you think that we still need to have a much more coverage, or you think that government is doing enough because they're providing the job, they're trying to give the, you know, now disability certificate is online, you can receive it directly into your Aadhaar link. So things are much better than before, but I still feel what are the things which really need to be taken by the government, as Dr. Palande highlighted during his comment, in today's India.
I think there is a lot to be done by the government in this regard. First of all, there is very little. Now, it's good that they have started this ministry, and also we can know, we can make out that they are taking some cognizance. But at present, it is not as much as it should be. I feel if at all you have to help the people who are differently disabled and get them back into society for doing productive work, then I feel a lot has to be done. First of all, I would say that the PMR was not there earlier. Now a subject of PMR has been introduced, which is there in hardly any very few institutes. I think we should start with first by changing the MBBS curriculum first of all and include this as a compulsory subject. Then only the students will start taking active interest and knowing about this. That is as far as the medical professionals are concerned, because they are also not aware of these things and whether the treatments are available. If you go to the cities which are smaller, at least in bigger cities like Mumbai, Calcutta, Delhi, there are some centers which have rehabilitation centers exclusively, but they are mostly at the private level. Whereas in government, there is very limited availability of beds and all for these people to come in to be treated and actually rehabilitated. So I feel government should take a cognizance of this and make a rehabilitation center almost in each and every civil hospital, I would say. Leave aside medical colleges. At present, even in all medical colleges, you don't have this kind of facility in government
Dr.
medical.
Palande, I just want to correct you that Government of India has now the rehabilitation set up at district level. It is a compulsory at all district level. There's an early intervention center, and at all district level, there is a rehab center is a must, which has been passed in the last 5-year health plan. So that's a compulsory rehab setup is there. So we are talking about disability certification, which is done at all district hospital and at the sub-district hospitals. We're talking about the neurologists who are not yet been able to be part of certification. So these are some of the issue, and we'll discuss that. We'll come back to you again. Guhan, I just wanted to learn from you that what is the disparity between the rural area and urban area? As you know that there are a lot of disability which is there in the rural, which is not even there, which is hidden, and they don't even go to the place where they're supposed to go.
Yes, sir. Thank you very much for the question, sir. And I apologize for being unable to answer to the previous question, sir. So with regards to this rural and the urban divide, and this was especially so evident for me when I did my fellowship in Singapore, which was at the top end. And right now, my intention was to do a rural rehabilitation. So I'm back in a rural place, in a village, to set up a rehabilitation. And I find the gaps that are there in the rural places. And in the urban area in Singapore, in the best of setup, right after the stroke acute treatment, the patient goes to the rehabilitation center. It is the choice of the rehabilitation center that is decided. Is it tertiary, is it secondary, or is it community based? And then they are going back to that center. But in rural places, even the concept of rehabilitation is so difficult. It just comes like PT comes home, and that's the end of a rehabilitation. They're not aware of an occupational therapist. They're not aware of the multidisciplinary team that needs to be developed for these rural rehabilitation. So it becomes very imperative on the part of the government and non-governmental organizations to educate not only the public, but also the doctors, the physicians in the rural areas about this multidisciplinary team that is required. So to bridge this gap, there are various things that we can take up. One is that we can take mobile rehabilitation units where people equipped in the urban can reach the rural area. Telemedicine has been a wonderful revolution where experts from the periphery, from the urban areas can reach the rural areas several thousand kilometers apart. And it's more important to train the community health workers. And we face a huge brain drain of the rehab, the therapist and the experts. So it is more important that we train people who are there in the rural areas to rehabilitate at the community level. And collaborative partnerships are required. We need to improve the public transport and infrastructure, create more awareness campaigns, and with the government policies and funding, and with a culturally competent care, we should be able to bridge the gap between the urban and the rural divide. Thank you,
So
sir.
take help of community, take help of NGO, involve, motivate the government, social worker. That may be the solution in the rural area. So Preeti, the speech and language, hearing disability, everybody knows, and there are a lot of people are working on hearing disability. But let's come to the speech and language and swallowing disability. How common it is and how it is not being addressed at all in today's society.
Yes, thank you, sir. I agree with you. I take forward Guhan's idea of rural and urban. I completely agree with it. There are children with disability who come, who need help or who needs attention at the young age early, but they reach us too late. Maybe a child with cerebral palsy comes at the age of 7 years. Maybe a child with intellectual disability comes at the age of 11 years. Maybe a person with stroke comes at after 2 years. So these are the challenges that are there, and definitely there is no awareness in the rural areas, which is important and which needs immediate attention. If you see urban, there are people who know about it, there are people who do not know about it. So definitely it's not, if you ask me, 20 to 30% of the individuals are aware of the difficulties that are faced in terms of speech swallow or communication, and it needs immediate plan or to go forward, how to plan on assessment, how to individualize the plan, or how to collaborate with the care team that is there, how to educate the families, and how to advocate for inclusive practices, and how to utilize assistive communication devices or swallowing strategies for reaching it. So if you ask me, not everybody know about it. It's if you ask me, look at India's population, if it would be 30 to 40% of them are aware of it, and lot needs to be done, and I think we all should take it forward from here to help individuals out there in the community.
Thank you very much, Preeti. Now, Porcelvi, you just come back after 1 year from the most developed country like UK. You have been trained, you work there, and you come back to India. What are the challenges you think you have to look at the neuropsychological disability, and how do you face them, and how do you have solution for them?
The first challenge is how we fit into the whole multidisciplinary setup itself. We need to say, oh, we do something that is beneficial to the patient. Like here, it's more of they see the doctor, as Dr. Gohin said, see the doctor, have a stroke, see the doctor, get home. Where does physiotherapy come in? If the doctor is aware and they tell the patient they need physiotherapy, then they go on to physiotherapy. So there it ends. So what about all these other fields that can actually be beneficial? And with stroke, we know that depression is a common sequelae. There is cognitive deficits, which can again be addressed. There are so many technological advances that can be implemented that can help people with stroke or any other acquired brain injury, but all that is not actually executed. And though we have a stroke pathway here as well, the rehab part of it is not integrated with the medical part of it, and that I feel is a very different experience when compared to the UK, because in the UK they're in the ICU and then they come straight out to the rehab, and there they spend 1 year, 2 years, and so obviously the financial burden of it falls on the patients here. But it would be nice to have neuropsychology and all these other rehab components fitted into the insurance and all that so that the patient doesn't have to bear the burden of it. So I think the policy itself, the policy and how it's implemented, the financial aspects of it, the societal aspects of it is what is the stark difference between UK and India, and I really hope that changes here.
Thank you very much. That brings to the important issue of insurance and the services provided. I think we come to the Vidya. What are the feeling of the patients, the people who are disabled? You deal with them day in and day out. How do you feel that what really a multidisciplinary team should do? How we can help you out in, achieving your goal?
Thank you, Dr. Surya. I think, firstly, we need assistance in spreading the word, creating awareness, because dementia and Alzheimer's disease is not very well known in not only urban, but much unknown in the rural area. So I think awareness talks, support by the CSR funding from corporates, definitely, an extended hand by the government for including a percentage definitely for rehab in rural areas. And we as an organization or as a daycare center, we are all out to do anything and everything for the cause of elders, aging population. And I think we missed out on something like counseling. Counseling is very important when somebody has had a surgery, for example, or a trauma. Family, the primary and the professional caregivers need a lot of support, and that is missing here. So I think they need to be talked to and to be able to handle the person who's going through the disease, disorder, or trauma. And of course, inclusion, sensitization comes out of more awareness talks. Social stigma is thereby reduced. And I think all of us can, instead of sympathizing, give empathy, compassion, and patience to these people. And they will be, we'll boost up their confidence levels. And rehabilitation, of course, is a major thing. And I'm glad I'm a part of IFNR and try to be as active as I can. And, I'm there all the time, anytime. And, we have stalwart professionals, people who've inspired me, and I'm just ready. Like today I'm in a canteen of a conference center, and I've come out for there, and I'm in the garden. So, I just need to be there, and time is running short, and all of us have to do things which should have been done day before yesterday. So unless we have a loud voice to catalyze and push the government from being lackadaisical and sitting on the back burner for all our commitments. Thank you.
Thank you, Vidya. And so we crossed to the 45 minutes. Now we are 15 minutes short. So let's begin a short questions, short points from each of you, because I think it's important that everybody's view are being given to the society. So far, I have learned that from your first round talking to you guys that we need to create an awareness about the disability in all form, particularly the neurodisability, among not only the patient, society, but among our own colleagues. The two is we need to do the training, and training should be for our multidisciplinary team as well as for the society as a community. And three is we need to look at the financial aspects, how the CSR work can be done, how the projects can be done. So these are the three key points so far from I have learned from you guys. So let's come to the second part and short questions. Taral, what are the barriers you think in India, and what are your 1, 2, 3 suggestions that these are the simplified way we can overcome that?
Absolutely, sir. Thank you, sir. So I've realized, being a disabled person myself, that government has all the intentions. My disability certificate was a cakewalk. The way the things have changed, I've experienced the other way around as a person with disability. So IFNR's role, sir, I feel is very important. And this role is government has intention to show them the right path, the right ways of doing it. We can do it at IFNR level. IFNR can change the public mindset, the public awareness. So awareness about disability and how to behave with a person with disability, the disability etiquettes. We have a good platform where we can reach out to mass in general. And as sir said, the changing the attitudes of our own medical professionals, because you have a spinal cord injury, but to refer that patient for rehab at an earliest is important. So train the medical professional themselves, and IFNR can do it very well. So what I feel is the gap, which Gohan spoke about and a lot of people spoke about, we will also need to promote research and new ideas and innovation, by which, with the scarcity of professionals, we can still reach out to every disabled person in our country. So India today has 40% of world's population, and 2.5% are people with disabilities. It's a huge crowd to reach out. And the only way to do this is using, the technology. That's the only way it can be done. So these are suggestions for IFNR to take lead and make it happen. Thank you, sir.
Thank you, Taran. Guhan, what are your point of view as a neurologist that these are the barrier and this is how we can, overcome them?
Thank you, sir. So with regards to this barrier, to put it in one line, it's that the availability doesn't match the need. So to make ends meet, the way forward that my mentor usually propagates is family-based rehabilitation and community-based rehabilitation. Since he is on the moderator side as a mentee, it's my job to advocate and propagate the family-based rehabilitation, because one thing that India, the strength is the population and the family. In Western countries, it's very hard to find one caregiver within the family. But here you can, Dr. Nirmal Surya sir has shown one family where there are more than 60 to 100 caregivers. So that's the strength of India. So straight away, we can use this family support for the family-based rehabilitation that can instantly produce change in the community. And this can be performed through tele-rehabilitation, where the multidisciplinary team educates and maintains the rehabilitation, where they train the family members. And thereby, this trained family member can take turns in providing rehabilitation. And this can be monitored by the multidisciplinary team wherever they are, in urban or rural areas. And that rehabilitation can reach the patient. And this can be an immediate measure that can be done to overcome the barrier. Thank you, sir.
Thank you. Thank you very much for bringing out the family-based rehabilitation. In fact, the family are the one who share the burden of disability. The head of the family take care of the disabled child. Do not ever allow anyone to overtake them. Give them the opportunity, give them equality. So I think that's a very, very important point. And this has been happening for years in Indian society, Indian joint family. But as the joint families are integrating into the nuclear or single family, things are changing. Suvarna, what are the barriers you feel as a physiotherapist, and how you think that this can be overcome?
Yeah, the first and foremost thing is the inpatient rehabilitation centers. That is where probably we need more of awareness amongst the medical professionals itself. I mean, as Dr. Taral sir has also said, patient after being discharged from ICU does not have a place to stay in the hospital in case if he needs rehabilitation, or if he wants to continue with the rehabilitation within the hospital setup itself. So I think the first and foremost barrier that I feel is the inpatient rehabilitation services are not available for patients who need rehabilitation. And as everyone knows, that rehabilitation is something which requires a longer period of time. It's not a question of 1 week or 2 weeks or a month. Probably patients needs a longer duration. Those who are willing to take it in patient rehabilitation, either the hospital, the centers are not available, or the place is not available. So that is one thing I think which needs to be taken care of. The second thing is as Dr. Guhan had said about the family-based rehabilitation, but the training of the healthcare professionals who will be providing this family-based neurorehabilitation is the need of time, and this is the changing need of the society, as I had mentioned in my first segment itself, that we need to understand what are the changing needs of the society. And for that, I believe the multicentric research is very well required. And through the findings of this multicentric research studies, then maybe probably we can lay down what are the changing needs, and probably we can develop the guidelines for providing the family-based rehabilitation, and which IFNR definitely can take care of. So thank you so much.
Thank you. Dr. Trupti, as an occupational therapist, as you deal with the children, what are the barriers you think and how we can overcome them?
I agree to all first three speakers, but adding to that, I feel there is a discrepancy in rural and urban areas. So what I feel is we can train the Asha. Say family comes, but the family also needs to know how to access it. So we have our Asha workers. So we can take an opportunity to train that Asha workers to identify the children problems at the earliest and train them to train the families with simple basic things before an expert comes into a role. And then, as everybody said, tele-rehabilitation all can come into action. But the first thing is, I feel at the grassroots level, we can train the ASHA workers. And I think I am going to an AIMS in Nanded. So my personal experience is when we had started doing that, it is showing us much more improvement than when earlier we were not having it just going once in 6 months. The improvement was much different than what we have been seeing after we had started training these ASHA workers. So that can be also taken into action. No, we train the ASHA workers because they are into them, they can connect with them better than the professionals. So that can be one of the things. And tele-rehabilitation has really boomed up after COVID, and that is really helping to connect with people all around the globe. So that is also one of the important things. But this was the barrier which we were facing, was the accessibility to the therapies. And that can be, I think, can be overcome with the ASHA workers. That was one of my solutions. Thank you, sir.
Thank you very much. Lukesh, as a authority, what are the barriers you feel that disabled people face, and what are the points which can help overcome that?
So the first and foremost barrier is to reach to the disabled people to for the orthotic treatment. Like if they reach also, then getting the appropriate treatment of orthotics is very important. So getting them a good material, orthosis with good material, so that the breakage and then maintenance will be less. That is foremost important thing. So providing them a good material, a biomechanically correct device is very important, and that is that will definitely help the disabled population in getting the accessibility and barrier-free terms and environment in the society.
Thank you, Lukesh. You know, awareness creating is very important. Jaipur food is famous all over the world. So we
Yes, sir.
really need to take this kind of model to reach out to disabled. Today, every person with amputee would want a Jaipur food, not only in India, but across. So I think that sort of an awareness is what is really required. And then that will break the many barriers, because if a patient himself wants it, the support, then I think he will get it. So we need to create that. If you need this, this is available. I think this is a very important point.
Yes, sir. The reaching the unreached is a goal.
Thank you. Selvi, as a neuropsychologist is a new branch, not many trained people around. In India, there are only few hundred. So what are the barriers you are facing, and how you think that the message to the neurologists or the people who take care of the neurodisability should reach out to you guys?
The first barrier we face is that in India, we rely too much on word of mouth, and patient tries so many different things and finally chances upon something that works for them. Instead of that, if we can have a protocol, a policy in place in like that, healthcare professionals, because in India, there's still the medical professional is the first point of contact. So if they can put in place referrals, and if they can point the direction for the patient, that first barrier would be easily overcome. The second biggest challenge I feel right now that I'm facing in practice with patients is that a disability is a disability only when the environment fosters it. So in our context, we tell patients, you can use all these like text to speech or automatic appliances and checklist strategies, all of that they can use to overcome their challenges, either in an educational setup or a workplace, because we want all of these people with disabilities to return to work if it's possible. But in the reality, in real life, we are still holding on to, it has to be done a certain way, like you have to give in answers written, in the exam, in the assessments. You have like there are very strong things that we are holding on to, which is fostering this disability in workplace, in the education settings, in our everyday life. So as stakeholders, if it is possible to educate organizations or schools, colleges, and all these settings where these disabled people go out into, and if they can implement whatever we do in the rehab, I think that barrier will be easily overcome, and then the environment wouldn't be adding on to whatever they are going through.
I think that's very, very important point which you have brought in, and I think you need to be more proactive with your father-in-law to create an awareness among the Neurology Society of Indian Academy of Neurology. I think that if they understand that early reference and early use, but then you would be so busy, so you have to create many more neuropsychologists under you to be able to serve the society. I think we need to get more people.
So I'm putting it on to, and the past president of IAN is there as well, and so many dignitaries who are all doing impressive work are here. You know, if we can put all of these in place, I think no place like it.
The special training program for the evaluation of neuropsychological, particularly those who are just MSc passed out, how we can train them to help out for the quick thing is maybe IFNR could take that forward.
Asian Neuropsychological Association is working for guidelines to be put in place for this specific things, because in Asia, not just in India, Asia, it is a setback. So we're trying to
and IFNR can definitely help in helping you out to train the more number of people.
Looking forward.
Yeah. So Vidyaji, what are the barriers being felt from patient point of view, and then we go last to the
I think we need to have soft skill training, not only for medical profession and paramedical or nursing and support services. Very important is police and traffic, because I think when it comes to dementia, that's the first point of access you have when a person has strayed or got lost. Then have projects, you know, whether it's architectural colleges or medical or nursing or social work. I think they need to do a project designed specifically for any disorder that is very, common, and the numbers of which are rising. Public campaigns by the government, because they can put it in all the newspapers, different languages. So, people who don't have internet facility, which is not as much, but cannot afford at least papers they can read. We also need to have various departments of the government, like social skills and social empowerment, health, and soft skills and training to get together, along with people like us, IFNR, who are actually wanting to do things, and they supposedly don't know where to go when we are ready to extend ourselves. And accessibility of public places, travel, transportation, point of information services, whether it's a post office or a gas station, where they can actually come and get help. And I think we need to join hands with whoever's ready, whether it's CSR or NGOs or even organizations in the government, to come together with us and work together for a policy that can make the less able more able.
Thank you. Preeti, from the speech and the swallowing point of view, what do you think that the barrier and how you can address them?
I think it's quite similar points that everybody has said. So first and foremost is there is limited access to education and training, may it be for all the healthcare providers as well as the patients. So as everybody has mentioned, family and caregiver training, hands-on training for them, putting them across to support groups is something which is very, very important, which we can work through it. And I think IFNR is a way ahead on all these things. creating an awareness and understanding the disorders that are related to speech language pathology and swallowing disorders and its intervention. The infrastructure and resources are something which is, there is a disparity in the rural and urban areas, making sure that the tools or the materials are available for low resource settings is something that we'll have to look at. There is limited interdisciplinary collaboration. So I think there should be a platform or a networking area where everybody can be put together so that they have case capsules or they have different discussions which can bring everybody together is something very, very important. Transportation is a challenge for all the patients who reach for the intervention. So I think something like outreach community-based programs is very, very important to provide services, again, inclusive of cultural and linguistic diversity that is there. Financial constraints is something that is a barrier, and I think we have all discussed about it. The other highlight that I would like to bring here is not everybody is eligible for disability. So example, if there is a patient with stuttering, or if there is a patient who is having psychological issues, or there is something about dementia, so there are certain patients who are not eligible for getting a disability certifications, wherein the other patients are getting. So I think inclusion of those disorders are also very, very important. So I think that's something which we should start from our line, from our side as an organization, looking at the guidelines that we provide. I'm sure the policymakers are going to refer to and take it forward, and they're going to definitely reach out to us if we make an attempt on creating a lot of awareness and promoting the activities from the society side. I think that would be my point, sir.
I think thank you very much. What is very important before I close and have comment from Dr. Palande is that we must understand that disability is not just one disease. We only talk about dementia, we only talk about the stroke, or we talk about cerebral palsy. The neurodisability is neurodisability, which is a group of disorder. And everybody should come together to raise one voice. And that one voice would be the equality, the services provided, equal health care, no discrimination. And that only will be able to give us sustainable development goal as being labeled by the WHO as well as the other government. The one voice, as Taral say, is the key word. What is happening is the activists working in their field only talk about their disease. We understand that the stroke is important, or dementia is important, cerebral palsy is important, Parkinson's disease is important. But for the government, each and every person is important, and we need to raise, because there are common points, and I've been telling this for last 5 years, that the common points of neurodisability should be talked about, which should be the healthcare, equality, no discrimination, financial help, insurance. If we all come together and talk about only these 5 things, we will automatically enroll into the each and every neurological disorder which has got disability. So let's change our own mindset and start working that first and foremost is neurodisability, then maybe the disorders which are related to that. And that's how we can reach to the government and make a difference. And we should give a message to all those who are disabled that you are not alone. There is a group of people who are there. If one person is not understanding your problem, we got others. Because suppose a patient has a dementia and he goes to the physiotherapist or other, may not be able to understand. But we have together, we are able to guide them and get their best out of whatever they have a difficulty remain. Dr. Palande, your closing comment.
It was a very good discussion on this issue, because it's a very important issue for the economic point of view and socio-economic, and all these people who are disabled sometimes as a result of accidents and certain disease are active people who are working, and once they are disabled, the whole family gets destroyed. So I think the whole crux of the matter is what everybody said was very important. But if you collate the whole thing, everything boils down to money. Today, the rehabilitation of any person is so costly that till the time he gets to the home rehabilitation, to come to that stage itself costs a lot of money for the whatever the treatment, the diagnosis, the management, the medicines, the cost. The investigations are also so costly in some of the neurological disorders that people cannot afford. And even the treatment is also very costly, going into thousands of rupees. So this aspect has to be taken care of by the government if we have to benefit the people in the interior who cannot afford anything of this sort. So I have got experience of people because I go to the villages, our relatives are there, and when we go there, there are people lying there on the bed, disabled. They are not able to do anything. And so I also get sometimes wonder how to help these people, because when you tell them to go to the we cannot go. When you tell them to take care in the house, they say no, we don't have any person now. Everybody has gone to Pune, Bombay, and all. Nobody is in the house.
Yeah, we got your point, Dr. Palande. I think the important thing is to have the insurance cover.
Program for rehabilitation, I would say, on the lines of TB program and this kind of other things we are having. So unless you do that, things will not improve, because you have to reach to the interiors.
I agree with you, Dr. Palande. Government is doing a lot of things, and Ayushman Bharat has included the rehabilitation into part of that. So I thank you all for your comments and your suggestions, your points, barriers, and I think we'll make a short report of this and send to the WHO through IFNR to the WRA that these are the points which has come as a multidisciplinary team from India as an IFNR members. Many of you are part of the WRA program in various capacity, and I'm sure you would be able to help the community in the future, thinking that we need to take care of neurodisability. I once again thank you very much, and I hope if anybody has any questions, those who are listening and maybe on the YouTube later on, they can send it at 2012 ifnr2012@gmail.com, and we surely will be able to revert to you. And I look forward to you have again on one of this with you as a panelist or as a speaker. I'm sorry if I've asked you something which is out of the course, but not that you will be all our expert, will be able to answer and make the audience much more interested and knowing that how we can help them out. Thank you very much once again.
Thank you.
Thank you very much, sir.
Thank you so much, sir.
Thank you very much, sir.
Thank you, sir. Thank you very much, sir.
So
Over to
time for
you,
a
Asmita.
selfie. So if everyone just smile, I'm going to take a selfie pose. Look at the cameras. Yeah. Give your best smile. Thank you. 1, 2, 3. 1 second. Yeah. Thank you, guys.
Thank you so much, sir.
Thank you, sir. Thank you very much, sir.
Thank you. Over to you, Asmita.
Thank you, sir.